Good evening, folks, and welcome to the Veterinary News Network. I'm lead anchor, Chuck Whiskers. Tonight's story, stomatitis, a disease that's affecting cats nationwide. The VNN has an exclusive interview with top research scientist Catherine Katzmeow at the Feline Research Institute. We're going to go ahead and cut now to our interview with Catherine Katzmeow as she explains to us some of the signs and symptoms, things to look for if your cat is affected with stomatitis.
Stomatitis is also known as gingival stomatitis. It's a common disease found in the mouth. It's a common disease of the mouth that's found in cats. It can be very painful and debilitating, in some cases even life-threatening. A cat with stomatitis can have facial swelling, nasal congestion, red or swollen gums, and have a difficult time eating, which can result in weight loss. Diagnosis is partially based on the symptoms. Your veterinarian should examine the inside of your cat's mouth, including the gums, teeth, and tongue. This can be hard if the cat's mouth is severely swollen. Tests can also be done on the cat's blood, urine, and fecal matter to further diagnose. Research is still being done on this disease, but as of right now the cause is unknown, which also makes it very hard to treat. There is no cure, but there are a few treatments, including pain medication and even lasers treatment. But in severe cases, some or all of your cat's teeth may need to be removed. The treatment is based on the severity of the disease. Stomatitis can become dangerous, but if caught in time and treated effectively, your cat can have a good quality of life. If you have any questions or concerns, consult your local veterinarian.
Fascinating. I'd like to thank our friends at Feline Research Institute for allowing us to grab that exclusive interview. What's that? I am being told right now that we actually have our lead reporter, Veronica Scratchington, in the field with an exclusive interview with a current patient suffering from stomatitis. We're going to go ahead and go now to the field. Veronica?
Thanks, Chuck. I'm here with Hope, who has a cat, Armani, who has stomatitis. So we'll hear firsthand what this experience is like. Hello, Hope.
Hi, Veronica.
So, Armani has stomatitis. When did this begin?
When he was about a year old.
A year old, wow. And what did the doctor say?
He said that he was basically allergic to his own teeth.
How tragic. And what were his symptoms?
He had really, really awful smelly breath, and his gums were inflamed, and he was not that into eating.
And what treatments did you do for him?
Initially, we did steroid injections every other month and toothbrushing, and then we removed his teeth when he was 2 or 3 years old and left just his canines in, and then a couple years after that we removed those.
So, I understand that you stopped doing the steroid injections. Why is that?
Because it gave him diabetes.
And what are you doing for him now?
He is getting laser therapy treatment and getting his mouth cleaned out.
I heard that's very controversial. How do you like the laser treatments?
It works really well for him. Supposedly with some cats it doesn't work, but luckily enough it helps manage his pain and we don't have to do steroids and he doesn't have diabetes anymore.
And Chuck informed me that you had another cat with stomatitis?
I did.
And what was that like?
It was really difficult because after getting her teeth removed, her system was so traumatized she developed FIP and ended up passing away from that.
I'm so sorry to hear that. How old was she when that happened?
About 5.
So that's our story. Back to you, Chuck.
Thank you, Veronica, for that truly heartbreaking story. Well, folks, that's going to wrap it up for us tonight here at the VNN. We wish you the best of luck, and always remember, spay and neuter your pets. Good night.